Welcome to our website. I'm Dr. Eric Marchant. Self-image is related directly to our self-confidence. When we are confident, we feel better at work, enjoy being in social situations, and are more comfortable in our personal relationships. Even a small physical change in your body can be a major improvement in your self-confidence. My greatest satisfaction is when I can make a patient happy about their appearance, sometimes for the first time in their life. Because plastic surgery can make permanent changes in your body, you're making a serious decision. I hope you will find many answers to your questions during your virtual consultation. Please feel free to contact our office for an appointment for even more information. Welcome to the breast augmentation section of your virtual consultation. I'm Dr. Eric Marchant. There are few procedures as sought after as breast augmentation. Most women undergo augmentation because they want to feel better about their appearance. They may feel self-conscious because their breasts have never developed to a size they feel is normal. The choice to have breast augmentation surgery can also improve self-image by helping to bring balance to the entire body or restore natural breast volume, which may have decreased as a result of pregnancy, weight loss, or aging. Whatever the reason, the results are very rewarding both physically and emotionally. If you have questions about your breast augmentation, your virtual consultation will be very helpful. Saline implants are filled with salt water and are inserted deflated. Silicone gel implants are already filled. Silicone gel implants require a larger incision under the breast because they are pre-filled. Saline implants give you a larger variety of choices of where to place the incision because they are inserted unfilled. All implants have a limited lifespan and will eventually need to be replaced. You can expect them to last about 10 to 15 years. It's true that on occasion they can fail sooner. They will need to be replaced at that time. Silicone implants tend to feel more natural than the saline implants. However, if you have ample breast tissue to begin with, either choice will feel natural. Your procedure will take approximately 45 minutes from the time you enter the operating room until you leave for recovery. You'll have about a 3-hour stay. Well, you should arrive 1 hour before your procedure. You should not eat or drink anything the night before. You'll meet the anesthesiologist who will talk to you about putting you to sleep. An IV will be started. If you are very anxious, you may be given something to make you feel more comfortable. The next thing you will know is waking up in recovery. Well, each person's recovery varies. I would like you to limit any vigorous activity for at least 3 weeks, but I want you to be somewhat active almost immediately. You should be mobile and moving as soon as possible. Walking, going to the bathroom, etc. I don't want you to be in bed all of the time. The faster recovery, the better the results. We will monitor you during your entire recovery. You will get a phone call from me the night of surgery and a phone call the next day. You will see me within a week and then on a weekly basis for the first few weeks until the healing and the results become more permanent. I'm always available for any questions or concerns. It's very important to take ownership of your procedure. The more that you participate in your recovery by following exercise programs, applying moisturizers, and performing massages, the more successful your new appearance will be. Well, it depends on the type of work. If it's vigorous or requires heavy lifting, then 3 weeks. If you work at a desk, for example, then 1 week is more accurate. Any activity that's going to get the heart rate up or that's aerobic in nature should wait at least 3 weeks. Mild exercise is fine, but nothing too strenuous. Although each person has a different tolerance to pain, you will experience discomfort for a few days, but it's easily controlled with medication. After about 48 hours, it will be greatly decreased. Sensitivity varies among patients. Some women notice an increase in sensitivity, and others less sensitive post-operatively. After about 6 months, it seems to normalize. Well, this is probably the most asked question and concern. We will give you a great deal of help and information that will guide you in your decision. We have before and after pictures with many different body and breast sizes right here on our website. You can also make an appointment to talk to myself or my staff for even more information. Breast augmentation will definitely help. During pregnancy, the breasts usually increase in volume. After childbirth, they decrease in size, but the amount of skin will stay the same. Breast augmentation will actually restore that volume. However, if they really droop because of excess skin, then you may need a lifting procedure. We can discuss that at your office visit. Well, if at your initial consultation we determine that the volume of skin is excessive, we may need to consider an additional procedure. Called a mastopexy, we remove the excess skin below and around the nipple and lift the nipple if necessary. This is determined before surgery. Well, around each implant, scar tissue forms called a capsule. For the most part, it's not a bad thing because it helps keep the breasts from drooping. But in some cases, it can become hard and thick. We will provide you with exercises and massage techniques that will help prevent this from happening. Because breast implants have become common, the mammographer should have no problem performing an adequate exam. Make the technician aware of your breast augmentation procedure. They will not burst under the pressure of the exam. Every effort is made to hide scars in skin creases and to disguise them wherever possible. We will also recommend skin creams and methods to minimize scarring. Well, expectations are affected by how well you are informed. I invite you to set up an appointment and come to the office. We have a great deal of information and computer-generated material for you to see. We have before and after pictures and testimonials from other patients that will help you better understand your procedure and your results.